So, what is SAD or seasonal affective disorder? So, today I'm going to be using the NHS website, the overview for seasonal affective disorder or SAD. I'll put the link below, and if you do need any more details on the overview, diagnosis, symptoms, or treatment, feel free to just click the link below and you can find out a little bit more. So, what is it? It's effectively like winter depression or winter blues. The people I know who have it kind of say that it just makes them feel kind of down or kind of off, like they just get very depressed during the winter months. Um, I've never really had too much of that problem, but I make sure I get out every day, see the sunlight, I go on a walk, I make sure I work out. I also take my vitamin D supplements and all the other supplements too, so I'm not deficient in anything, and I think that does help. So for the symptoms of SAD, here it's got persistent low mood, irritability, feeling lethargic, despair, guilt, worthlessness, difficulty concentrating. So some depressive symptoms, but also some other symptoms such as like decreased sex drive, craving carbs, and gaining weight. So when should you see a GP? So according to the NHS website, if you think you have SAD or SAD and you're struggling to cope, then you can speak to your GP and they can kind of like carry out an assessment, help check your mental health, and see whether you are being affected by these seasonal changes. So, what causes SAD? So, they have three theories here. One is the production of melatonin. Melatonin is produced in the evening and it helps you sleep. I believe if you get more sun exposure during the day, you get better melatonin release at night. And also, if you're unrelated, but if you're on your phone too much at night, it can stop your melatonin being released. It's very important in helping you sleep. But they're saying maybe people with SAD they might have too much melatonin, and I guess that melatonin will probably be higher in the winter months because you have less sun exposure, and sunlight can help suppress melatonin. But I believe if you get sun exposure during the day, you have better release of melatonin during the night. So it apparently, well, they theorize also a lower production of serotonin can cause SAD. So lower amount of sunlight, they feel can reduce your serotonin, which will obviously make you feel more depressed and not as happy. And then next is the body's internal circadian rhythm. They talk about how sunlight affects your circadian rhythm. You wake up, you see the sunlight in the morning, it kickstarts your circadian rhythm, along with you eat, etc. So they're trying to say that the lower levels of light might not be kickstarting your circadian rhythm as well. I mean, especially if you're inside, it's very important to still get out because it's still a lot brighter outside than it is inside, even in the winter. So, and then, sorry, even in the bottom, they say, additionally at the bottom, sorry, they say, it could be the results of genes. They say it appears in families. I guess that could like be partially true. Obviously, like genetics play a big part in everything, so could definitely be the case. In terms of the treatments they recommend, they say lifestyle measures, so you can get as much natural light as you can, so getting out, exercise, and managing your stress. They also talk about light therapy, which is where you get a special lamp called a light box, and that's used to stimulate exposure to sunlight. There's talking therapy, such as CBT or counseling, which can be used for a variety of different things, actually. And then antidepressant medication, which is SSRIs, so they will increase your serotonin and hopefully make you feel better. So that's the overview on the NHS website. You can Google them yourself, or you can click the link below, and then you can find a little bit more about diagnosis, symptoms, or treatment, or any other resources. You could probably just Google SAD or seasonal affective disorder, and you can find out more. Anyway, thanks for watching.